Hello, my name is Ali. I'm gonna do your physical assessment today. Is that okay with you?
Yes.
Perfect. Let's begin by you telling me your name.
Freddie Control.
Full date of birth.
August 6th.
Okay. How are you feeling today?
Excellent.
Okay. Any complaints?
No.
Pain? Anywhere?
No.
All right. So general survey of the patient indicates a clean and well-kept appearance. Patient is alert and oriented and appears to be in a good mood. His skin color is appropriate for his ethnicity. So I'm going to begin by palpating and inspecting his head for any lumps, bumps, lesions. I'm looking for mites or dandruff and hair distribution, which is pretty easy because he does have short hair. I'm going to go ahead and palpate the back of his neck at this point for the lymph nodes. Any pain?
No.
Okay, perfect. I'm going to go ahead and begin with the face. There is no facial droop present. I will assess for cranial nerves number 5 and 7. Can you please raise your eyebrows? Okay, smile, frown, stick your tongue out. Okay, great. Close your eyes tightly. I'm going to try to open them. Alrighty, so great. This indicates that cranial nerve number 7 is intact. So now I'm going to test the trigeminal nerve, which is cranial nerve number 5, for facial sensation. Okay, so you're going to tell me if it's soft or sharp when you feel it. Close your eyes.
Soft. Sharp. Sharp. Soft. Soft. Sharp.
Perfect. So that now I'm going to go ahead and ask you to bite down. I'm going to palpate the temporal muscles and the masseter muscle, and I'm feeling for bilateral even muscle tone, which I did. Cranial nerve number 5 is intact. Now for the eyes, I'm going to go ahead and check the peripheral vision. I'm going to ask you to look at my nose and cover one eye. Okay, I'm going to hold up a finger or a set of fingers, and you're going to tell me what you see.
2, 2, 0, 1, 2.
Okay, then other eye.
1, 2, 3, 2.
Okay, so great. Now I'm going to go ahead and check your vision, your near vision. So you're going to cover one eye, and you're going to look at this chart right here and tell me, read out loud the lowest line you can.
L, T, F, B, H.
Okay, cover the other eye and read it backwards.
H, B, F, T, L.
Perfect. So that tells me that you are 20/20, indicating normal visual acuity. We are going to move into the Hirschberger's test, which is used to assess the alignment of the eye, and it detects strabismus. I'm going to shine a light into your eye, and I'm going to ask you to look straight into the light, okay? I'm going to be observing for the reflection of the light in the corneas, okay? So just look straight for me. Okay, great. The reflection is symmetrical and centered in the pupils of both eyes, which is indicative of normal alignment. Now I will do the cover-on-cover test, and I'm going to look for lateral movement of the eye. So look straight. Okay, and the other. Alrighty, so no lateral movement of either eye, which is normal indication. Moving on, we will examine the extraocular movement, which tests for cranial nerves number 3, 4, and 6, okay? So please, I'm going to hold up a pen, and you're going to look at that pen. You're going to follow it with your eyes only. Don't move your head. Okay, so symmetry of the movements are noted, no deviations, no lags noted, indicating cranial nerves number 3, 4, and 6 are intact. Now I'm going to inspect the lacrimal apparatus and the conjunctiva, okay? Alrighty, look up, look down, okay, look up. Alrighty, so lacrimal apparatus are both intact, pink, no exudate noted. And I also noted that the sclera is white in color, no lesions, no drainage noted, and the conjunctiva appears to be pink in color. Now we will check for perla, okay? So cranial nerve number 3, I'm going to shine a light into your left eye. Look straight ahead, okay? And again, perfect. Now I'm going to do this again, but I'm going to be checking the opposite eye. The constriction rate should be normal. Actually not normal, but they would constrict at the same rate, which they did. So that tells me that pupils are equal, round, and reactive to light. And now I'm going to check for accommodation. You're going to go ahead and focus on this pen light. Perfect. So the pupils are reactive to accommodation. He does have perla. Now I'm going to do the fundoscopic exam. So I want you to go ahead and look at the light for me, okay? Okay, perfect. And now I'm gonna Just look straight ahead. Okay, left, right with right. And now left with left. Okay, so red reflex was noted with no opacities or white spots within the red reflex area bilaterally. And all aspects appear to be symmetrical and no white spots or hemorrhaging noted. The optic nerve and the optic disc are both intact. Next, I'm gonna, while I was doing that, I did inspect the eyes. I've observed that they are properly aligned, properly spaced apart, eyelids are intact, no lesions noted, and the eyelashes are evenly distributed bilaterally. I'm gonna go ahead and continue with the ears. So I'm inspecting for position, size, shape, symmetry, which all appear to be equal bilaterally. I'm gonna go ahead and palpate the pinna and the targus. Any tenderness or pain?
Nope.
Okay, great. Now I will, I'm gonna assess and I'm going to use the otoscope to inspect, okay? Basically, I'm gonna go ahead and inspect the inside of your ears. I'm gonna pull. Okay, pinna up, back, and out. Let's take a look inside. Okay, same with the other. Pinna up, back, and out. And tympanic membranes are pearly gray, intact, with no visible drainage, swelling, bulging, or redness. Now I'm going to test for your hearing, okay? I'm going to first perform the whisper test. So I'm going to stand on this side, you're going to cover this ear, I'm going to whisper a word, and you're going to repeat.
Pencil.
Perfect. The other side?
Crayon.
Perfect. So this tells me that his whisper word is intact bilaterally. So moving on to the rhyme test, I'm going to use the fork. I'm going to strike it. Can you hear that?
Yes.
Can you hear that?
Yes.
Tell me when you don't hear it.
I don't hear it.
Okay. Can you hear it?
Yep.
Perfect. I'm going to do the other side. Can you hear that?
Yes.
Great. Can you hear it?
Yes.
All right. Tell me when you stop.
Stop.
Okay. Can you hear it?
Yep.
Perfect. So now we're going to move on to the Weber test. So can you hear it?
Yes.
Okay. Equal on both sides or
Yes.
more on one?
Equal.
Okay. So that tells me that he's got no lateralization. I'm going to move on to the nose, and I'm going to begin with the inspection of shape, symmetry, skin, and all seems to be normal. I'm moving along to palpating the bridge of the nose. Okay. Any pain?
No.
And the soft tissue? No pain, no tenderness?
No.
Great. I'm going to palpate the frontal sinuses and your maxillary sinuses, okay? Tell me if you feel any pain or tenderness.
Good.
Not there.
Good.
Maxillary, awesome. So let's take a look at your nasal cavity. I want you to close one there. Take a breath. And the other. Perfect. That tells me patency is good. Please tilt your head back. I'm going to take a look inside with the otoscope. Okay, I'm looking on one. Looking at the other. Righty. So I looked at the turbinates, the septum, and I was looking for foreign bodies and or lesions, any exudate, erythema. All of that was negative. The turbinates are pink bilaterally, no drainage, no bogginess or swelling noted. Now I'm going to test for sense of smell, okay? So just take a sniff and tell me what you smell.
Vanilla.
Okay, so that's cranial nerve number 1 is intact. I'm going to move on to your mouth and throat. So I'm looking at the external portion of the mouth, which appears to be normal in symmetry, no lesions noted. Next, I'm going to inspect the inside, which is your buccal mucosa and your gums, okay? I'm going to shine a light in there, open your mouth, okay? So I'm looking, I'm going to, great, no, let me get this light better, okay? No swelling, no bleeding, no redness, no lesions noted. I'm also making sure, that the teeth are intact, which they are. I'm inspecting for the parotid glands, which is beside the, the second upper molar on both sides. Great. Tonsils are visible. No redness, swelling, or stones noted. Okay, so stick out your tongue to the left, to the right, up, down, press against the, alrighty. So that tells me that cranial nerve number 12 is intact, which is the movement and the strength of the tongue. Please say ah.
Ah.
Ah. Open wide. Okay, I see the uvula, it does come up a little bit, which is normal. And then I'm gonna look up at the soft and hard palate. Perfect. No lesions, no redness, no bleeding, no swelling noted. Now I'm gonna assess for the gag reflex, okay? Open up. Oh, thank you very much. So that tells me that cranial nerve number 9 and 10 are intact, which are responsible for a gag reflex. So I'm gonna assess your taste, okay? Just open up. Tell me what you taste. Oops, sorry.
Sugar.
Okay, perfect. So that is cranial nerve number 7 and 9 for a sense of taste, okay? So while inspecting the mouth, I did not notice any halitosis present. And next, I'm gonna move on to the neck. So I'm standing in front of you. I'll inspect for general symmetry. I'm checking the skin for any lesions, any masses, any swelling. Okay, any pain?
No.
Okay, no masses or anything noted like that. So please, I'm gonna ask you to put your chin to your chest. Okay, now that's flexation up as far as you can. That's extension here and that. I'm looking at his tracheal position, which seems normal. Please look to the left and the right. Now, without shrugging your shoulders, touch your shoulder with one ear and the other. Okay, so now I'm going to auscultate your carotid arteries. Okay, first I'm going to palpate. Perfect. Okay, auscultation. Okay, great. Now for the thyroid. Okay, and the isthmus. Alrighty, so no bruise noted in any areas. I'm gonna go from the back and I'm gonna put my hands around your neck. I want you to take a nice swallow. Alrighty, so I was feeling for the thyroid gland to move up under my fingers and I was checking for any nodules, which I did not feel any nodules. I'm gonna move on to your lymph nodes. Okay, your posterior, preocular, okay, parotid, submandibular, submental, posterior, anterior, subclavicular, infraclavicular. Perfect. I didn't feel any nodes, which is normal. If I felt something, an enlargement, that would be abnormal. So lastly, I'm going to assess for cranial nerve number 11, which is essential for neck and shoulders, okay? Look that way against my resistance. Perfect. Look this way. Perfect. I'm going to put my hands on your shoulders. Shrug your shoulders. Okay, one more time. Okay, great. So that tells me that cranial nerve number 11 is intact. I'm going to do your posterior chest. Can you face that way? Alrighty. A little bit more so cameras can see. Okay, so I'm going to begin with inspecting the skin, which is clean, dry, and intact. No rashes, no lesions, no pallor. As for his thoracic configuration, I'm inspecting for shape, symmetry, any kind of deformities, and breathing pattern. I'm going to palpate the thoracic muscles and his rib cage. Okay, I'm looking for any tenderness, any pain?
Nope.
No, I don't feel any masses. So no lesions, no bulges, no depressions, or any unusual movements. Great, so all this appears to be normal, and now I'm going to check for your thoracic expansion, okay? So I'm going to place my hands on your lower ribs, and I want you to breathe and exhale. One more time. Alright, so my hands did move evenly bilaterally, which is what I'm looking for. And now I'm going to go ahead and check for tactile friendliness, okay? So when I place my hands on your back, I want you to say 99 loudly.
99.
Loud?
99. 99.
Perfect. Okay, so vibrations are equal bilaterally. And now I'm going to percuss over the intercostal spaces, okay? Making sure that there is no, that I'm not percussing over the scapula or any bony prominences. Alright, so he does have resonant sounds which indicate healthy lung tissue. Now I will evaluate his diaphragmatic excursion using percussion. So, percussion, sorry, I need this. Okay, so I'm gonna ask you to take a deep breath and exhale it and hold it, okay? Exhale and hold. Okay, I'm gonna mark it. Okay, Freddie, go ahead and take deep breaths, like normal breaths, deep breaths, okay? Now I'm gonna ask you to take another deep breath and hold that deep breath in. Hold it, hold it. Okay, I'm gonna mark it here. Okay, and that tells me this space is approximately 3 to 4 centimeters, which is within normal limits. I'm going to listen to your lungs, and I'm gonna ask you to breathe slowly while I listen, okay? Okay, great. So I've heard reticular breath sounds in all lobes. They're clear, non-diminished, no crackles, no rhonchi, no wheezing, and no friction rub. I'm going to go ahead and turn to the side, and I'm going to do the anterior chest. I'll begin with inspection of the skin, which is clean, dry, and intact. No rashes, no lesions, no pallor present. I'm also inspecting for shape and symmetry, and any kind of deformities. I'll palpate, checking for masses and any lumps, bumps, masses. Any pain? No? Okay, great. So now I'm going to your thoracic expansion, just like we did in the back, okay? I'm going to place my hands under your ribs. I'm going to ask you to breathe. One more time. Okay, so that was an even in and out, which is what we're looking for. Now I'm going to, assess your respiratory rate, which I normally don't tell the patients, but I'm going to go ahead and look at the clock for 15 seconds. 4 respirations in 15 seconds, that's 16 breaths per minute, which is within normal limits, and his respirations are even and unlabored, and no use of accessory muscles noted. Okay, so now I'm going to percuss the anterior chest, okay? I'm going to percuss. So, okay, great. That was the percussion. I'm going to auscultate your breath sounds, okay? Take deep breaths. Okay, great. So I hear vesicular breath sounds, no rhonchi, no rails, no crackles noted. I'm going to go ahead and continue with the heart. So I'm going to auscultate the heart, but before I do that, I'm going to palpate to familiarize myself with your structure, okay? So here's the notch, your sternal notch. I'm going to go down, 1, 2, and here at the second right intercostal space is the aortic. I'm going to move left to the second intercostal space in the left sternal border is the pulmonic. I'm going to go down to the third left intercostal space. Sternal border is the Erb's point. I'm going to go down to the fourth intercostal. Left sternal is the tricuspid, and I'm moving over down to the fifth left mid clavicular, that is the mitral valve, okay? He has regular rhythm, S1 and S2 have been noted. I would auscultate again with the bell to listen for any S3 or S4s or murmurs, but for the video, I'm gonna go ahead and continue. And while sitting in the 90-degree position, I'm looking for the JVD, no JVD noted, so no jugular distension. Now I'm going to go ahead and Look for your, aortic, renal, and iliac. So while you're sitting down, I'm just gonna do your aortic on the left. Okay, then I'm gonna move down a little bit for the renal, bilaterally. And then I'm gonna do iliac by the iliac crest. Okay, and I'm gonna go down to the femoral, as slow as I can. Okay, and on the other side. Perfect. So, okay, no bruise noted. I will palpate. Okay, no masses. Look for the femoral nodes. No enlargement of the femoral nodes. Okay, now I'm gonna go ahead and do your brachial. Great. The radial. The ulnar. I'm gonna check your popliteal. Your dorsalis pedis. Let me get that. Okay, and your posterior tibial. Perfect. So all pulses are +2, which indicate normal findings. I'm also going to check for capillary refills. Let me get your fingers. No clubbing noted. Toes. Okay. All were less than 3 seconds, which is normal refill time, and no edema noted in the lower extremities. Thank you so much. That concludes our exam. Do you have any questions? Perfect. Thank you so much.